The aim of this project is to develop a really easy-to-use digital self-report physical activity measurement tool that accurately captures different aspects of physical activity behaviour that we know are important for health, such as strength and balance, moderate and vigorous aerobic activity, but also those kind of daily habitual light activities as well, which it's becoming ever more apparent are important for older adults.
With self-report data collection about older adults' physical activity currently, there's two main issues that you quite often come across. Firstly, some measures are quite difficult for older adults and general public to interpret. So in terms of understanding the terminology that's used, it's not always easy for people to be able to kind of understand what's used by certain terms. So we want to develop something that's interesting for them to use, engaging, and easy for them to be able to accurately report their own physical activity. And another common problem that you come across is that some self-report measures don't actually capture all aspects of older adults' physical activity. So they might measure moderate and vigorous forms of physical activity, but they might not capture, for instance, strength and balance type activities. And we want to develop a measure that kind of measures across that spectrum. So the tool we want to develop will hopefully address those problems by working closely with older adults during the development phase to create something which is accessible and engaging for them, but also accurately captures data across their range of physical activity experiences.
We're actually using something called the person-based approach, which is all about understanding in detail the needs and the preferences of the target user. In this case, it's older people. So we use qualitative interviews first to understand how older people view physical activity, how they talk about it, how they really understand it, so that we can present a measurement tool in a way that makes sense to them, that's really accessible and easy to use.
In this study, we're using online technologies such as HTML, web coding, to develop a tool that will be accessible and interactive and then can be delivered across hopefully any digital platforms, either on a computer or a tablet, and then easily used across different studies, different environments, such as within the NHS or in community.
If we're able to create a digital tool that's reliable and valid and helps us to measure physical activity in older people in a more accessible and easy to understand way, then that will help us to get more accurate measurement of physical activity in older adults. And that's really important because at the moment we're not really measuring it very well in research, and objective measurement is really expensive to do, although more accurate than self-report. So to have a good self-report measure that's accessible for that group is really important.
Through helping to create a better understanding of older adults' physical activity, it can help them to improve their physical activity, to increase their physical activity, and ultimately can benefit their health in general.
We're hoping to have a tool that will not only help researchers, but will actually directly help the people who are filling it in by giving them that immediate feedback and potentially suggestions of how they might be able to improve their own physical activity for their own well-being.
We also see this hopefully becoming something that's embedded in everyday practice and maybe in primary care settings, so that older adults can download our tool, they can understand more about their physical activity behaviour, and they can start thinking about ways that they might be able to improve their lifestyle and ultimately their health and their well-being.